Hi, I'm Dr. Kave, and I care for patients who divulge their deepest secrets to me every day. It comes out in ways that you might not expect, though. It's because when you're under anesthesia, your body is revealing secrets about itself that you've probably never admitted to anyone before. But you have to know how to read the signs to figure that out. It comes through body language, which is a pretty secretive way that you can read other people. But can you control your body language even when you're unconscious under anesthesia? And what happens if your secrets spill out unintentionally? And my patients are always afraid of becoming embarrassed by what they say or do. But what they don't know is that revealing these secrets can actually make them more resilient and healthy at home and at work. First, you have to understand how anesthesia works in the body and the brain, because it can cause people to do silly or cringy things. It can affect your central nervous system, which affects all the other nerves in your body, like in your heart, in your muscles, and in your lungs. And most importantly, it can affect the parts of your brain that are in charge of inhibiting your potential. Like so much of that negative self-talk that contributes to anxiety, depression, and ultimately hurting our productivity and our potential. It's because anesthesia literally turns off the nerves all over your body. And nearly all organs in your body have nerves in them. Everything from your brain, which has a ton of nerves, and your gut, which also has a ton of nerves, but also your heart, your colon, your bladder, the muscles in your body. Pretty much anywhere in your body where there are nerves, there's a potential for the anesthesia to interact with those nerves. And the secret that nobody talks about is that the way the anesthesia medications interact with all those nerves all over your body is determined in part by the secrets that your body's been holding. Things you may have never told anyone else, much less admitted to yourself, like mental health struggles that contribute to anxiety, depression, traumas that have turned into PTSD, addictions, phobias, and especially medication use and substance abuse. So let me give you some concrete examples. If you're mildly sedated, like for a colonoscopy or an endoscopy, you might not have a breathing tube in place, like this breathing tube here. If you don't have a breathing tube in place, it means you can talk. And if you can talk, with anesthesia turning off the parts of your brain that ordinarily would stop you from blurting out things, you might share a lot of cringeworthy and outlandish things. It happens all the time, and we keep that talk in the operating room like Vegas rules. If you're under deeper anesthesia, like for a more major surgery, you might have a breathing tube in place like this one that physically sits in your mouth and prevents you from talking to us. But that doesn't stop your body from sharing secrets about itself with its body language. That body language is coming out based on how those nerves are interacting with the anesthesia that we're giving you. And it shows through your heart rate, your breathing, body temperature, muscle tone, anesthesia requirements, and a lot more. And this is the most important thing you can possibly take away from this video. It's that your body keeps score of the good and the bad. Your body physically and mentally takes a toll or gets a boost based on what happens to your body and how you consciously decide to react to it. This is super important for all my patients and the organizations that I speak to, so I'm gonna say it one more time. Your body keeps score of everything that happens to it and how you consciously decide to react to it. Yeah, it's like taking responsibility for how we consciously decide to react to our environment, even for things that we can't necessarily outwardly control. And these tolls on your body and these positive boosts on your body are revealed in your interactions at work, in your relationships at home, in your body's organs when you're under anesthesia. That body language really reveals secrets about your body, like unprocessed anxieties, depression, past traumas and PTSD, addictions, and substance abuse, especially alcohol use, marijuana use, and amphetamines. And even some prescription medication use like antipsychotics, antidepressants, pain medications, especially opioids, and anti-anxiety medications like benzodiazepines. They all interact with anesthesia in ways that reveal their presence in your body. The most fascinating and empowering part of this is that you can also heal your body in this state under anesthesia to live your life with more happiness, joy, and productivity. With the right guide, you can use this disinhibited state of anesthesia, where the anesthesia is turning off parts of your brain, like being able to turn off the parts of your brain that are always telling you, I'm not good enough, I'm not smart enough, I'm not fast enough, I'm too afraid to try this, I can't do that. Turning off this negative self-talk can be incredibly liberating. And these mental health struggles are some of the costliest health burdens and causes of absenteeism, poor employee citizenship, productivity, and turnover. This is why good health is good business. To be clear, I'm not saying everyone should experience anesthesia. I'm saying everyone should know just how powerful the effect of our thoughts are on our physical body, like what we see under anesthesia here in the operating room. This catalyzes my patients and the organizations that I speak to learn how to master the mind and body with few, if any, medications. And you have more power to master your mind and body than you've probably ever been told.